Eating disorders affect people of all ages and backgrounds. They cause significant emotional and physical pain, impacting not just individuals, but those around them too.
At the Royal College of Psychiatrists, we run the National Audit of Eating Disorders on behalf of NHS England and the Healthcare Quality Improvement Partnership. Our goal is to use data to improve care for everyone living with an eating disorder in England.
The first step in achieving this goal was mapping NHS-commissioned eating disorder service provision across England to understand what is currently available, identify gaps in care and areas for improvement. Almost every service took part and completed surveys about the type of care they provide. For the first time, we now have comprehensive data about eating disorder service provision in England.
To produce the report, we worked closely with people with lived experience of eating disorders, as well as clinicians, academics, and others. Our goal was to create a service mapping report that's clear and helpful for patients, carers, and professionals. The report contains detailed data on many aspects of service provision. We've produced this video to provide a snapshot of some of the key findings.
We found multiple strengths. Every area has at least one community team for adults and children and young people.
85% of children and young people teams and 90% of adult community teams reported that they provide cognitive behavioural therapy for eating disorders, a NICE recommended therapy for all ages. NICE is the National Institute for Health and Care Excellence, and they provide advice on healthcare for the NHS.
Other evidence-based treatments that are mainly recommended for children and young people, such as family therapy, or for adults, such as guided self-help, the Maudsley Anorexia Nervosa treatment for adults, MANTRA, specialist supportive clinical management, SSCM, are also widely available. For avoidant restrictive food intake disorder, or ARFID, there are currently no NICE recommended therapies, so we don't know yet how widely therapies are available for this eating disorder.
But there were also gaps and inequalities in care. Caseloads in adult community teams are nearly twice as high as those in children and young people's teams. Waiting times reported by teams vary widely, with adults waiting longer on average for assessment and treatment than children and young people. Adults wait an average of 42 days for treatment compared to 4 days for children and young people. Sometimes waiting times are much longer, ranging up to 450 days for children and young people, and up to 700 days for adults. Here is a quote from someone with lived experience. Waiting lists can be difficult in terms of where you are at with your recovery, being referred and feeling ready, but if there is a long wait, struggling physically with anorexia, being too unwell to access a therapy, and ending up in inpatient care.
Self-referrals, which help reduce barriers to access and support early intervention, are accepted inconsistently across community teams. 62% of children and young people's teams accept self-referrals, compared to only 15% of adult teams. Support for some eating disorders is limited. Binge eating disorder is treated by 63% of children and young people teams and 55% of adult teams. Avoidant restrictive food intake disorder, or ARFID, is treated by 48% of children and young people teams and 29% of adult teams. Here is a quote from someone with lived experience. My son has ARFID. We were only referred because we ended up in their local hospital. Even when you get into a service, there is no particular pathway. In the past 5 years, we have been in 3 different teaching hospitals in London, which all have taken a very different approach.
It is important to recognise that we have presented a national picture of eating disorder services, and individual experiences of patients and carers will vary. We hope these findings provide a foundation for real, meaningful improvements in eating disorder services in the future that address the gaps and inequalities in care that have been identified.
What happens next? Mapping services was just the first step. Here's what we'll be doing in 2026. We'll look at staffing levels, skills and training in eating disorder services to understand how well teams are equipped to provide care. We'll do a patient-level audit where we'll look at access and waiting times interventions and outcomes so we can see what's working and where improvements are needed. And we'll work directly with eating disorder teams to help them make changes that improve the quality of care for patients.
If you'd like to read the full service mapping report or learn more about the audit, please visit our website. Thank you.